entire family of Datta Mega Institute of Medical Sciences, specifically Principal Srimati Radhabai Mega Memorial College of Nursing, and entire faculty of the College of Nursing. And my special thanks to Madam Pooja for connecting me to all the participants who have come across Maharashtra and other parts of the states. And the topic has been assigned to me is Futuristic Nursing, Research and Global Inequalities. It's a very apt topic to talk today. If we say that research is an essential part of growth of any profession, and it becomes more important for nursing profession because nursing profession is a young profession and an old art. Any young person requires more nutrition, and professional nutrition is research here. Research in nursing is of great importance because it helps nurses to make sound decisions and provide them opportunity to practice evidence-based nursing care. Now, if we look into what are the areas where we are going to focus on nursing research in the future, then it comes the patient-centered care. How we can enhance the care which we provide becomes totally patient and family-centered. And we have more and more technology integrated into system so that the errors can be prevented and accuracy and effectiveness of care can be increased. Interdisciplinary collaboration is the key. Nobody can work in silos, be it doctor, be it nurse, paramedics, or any other healthcare professionals. So when they work in collaboration as a team, the research also must have in a collaboration as interdisciplinary collaborative research. Health equity and global health is a major area where research is required because there's a lot of inequalities around the globe. And you know that now it has become a global village phenomenon. We are moving very fast from one place to another place and we are crossing borders of the country. That was the reason that COVID has spread everywhere. So global health has become a concern. Ethical, cultural considerations into care and evidence-based practices. Policy and advocacy, health promotion and prevention are still continue to be a major research areas in the future when we talk about nursing research. Now, let me touch upon global inequalities, which refers to disparities, differences, uneven distribution of resources, opportunities, outcomes among countries, regions, and populations. If I give you an example, there is health inequality in India in urban area and rural area. Large number of hospitals are concentrated in urban areas, whereas there are far places where there is no access to even basic healthcare facilities. And this is a fantastic example of health inequality. Inequalities could be many types, like income inequality, access to education for people, gender inequality, healthcare disparities, and access to the clean water and sanitation and climate change impact. Believe me, every one of these other 5 inequalities, be it income, education, gender, and access to clean water and sanitation, climate change, ultimately lead to problems and challenges into health and healthcare. Now, if we talk about focus of nursing research in addressing global health inequalities, major area remains maternal and neonatal care. And data has shown that highest rate of maternal and newborn deaths and stillbirths are in Africa and Asia compared to other countries. So we need to understand this and focus that how we can minimize. Sri Lanka has shown very good results and we can learn from it. Now, technology is a key area. There are a lot of tools which has given us opportunity to reduce these inequalities and provide the quality and access to the care in maternity healthcare system in the US. This paper talks about it, the same technologies can be brought up to other regions like I've talked Africa and India, and this research can give us answer here that the same kind of benefit it can yield to the regions which I have talked. Now, if we understand about futuristic approach in nursing research, then cutting edge methodologies and technologies are going to be central because they will change the advancing nursing practices, they will change patient outcomes, they will address the emerging health challenges and provide solutions for them. And these are the major areas where now there is a buzz around the globe. They talk about tech health and tech medicine for tech nursing, and there are a lot of wearable technology, healthcare related technologies are coming, which are providing solutions. Bioinformatics has become, the big data has become a talk of today. And genomic precision health and 3D printing of the organs, automation and robotic uh, care or medication, like the physician books, and big data analysis and artificial intelligence and virtual reality are the talk of today, and they are somewhere center point of tomorrow's nursing research. Now, telehealth and telemedicine, if we talk about, futuristic technology will promise us improving healthcare access in remote areas. And they will also help us in implementing technology, which will decrease the cost, and they will definitely will decrease the travel time as well. And the aim of future approach to the nursing research will remain on these three areas, that is creating research culture, obtaining sufficient funding for essential research, and develop sound research infrastructure. Now, if we talk about creating research culture, uh, wherever you have seen the culture is created, people have motivation from each other, and when they collaborate together, they really can produce wonderful research. So here I say that there is a need of or in this slide is uh, we need to, the clinical nurses or nurse clinicians need to collaborate with nurse academicians, which will provide the high quality, strong base of evidence-based care and nurse-led research, and better decision making and better practices and policies. Now, obtaining sufficient fund is essential. Recently, NITI Aayog have directed a committee to give guidelines how the funding can improve for nursing research. And we are into a process of recommending Government of India that a nursing research cell must come up within ICMR or Department of Health Research, where there is a separate fund is allocated for nursing research and student nurse STS projects. So the specific funding will start happening to nurses per se. And in US model, where there is a National Institute of Health, and under that there is a specific funding happening to School of Nursing. So similar funding can happen in India as well. Developing sound research infrastructure is very important. Now, what is required for research infrastructure is good libraries, the very equipped faculty, the finances, and research labs, and they are technologically loaded, will definitely provide solutions. Now, if I talk about inequalities, which remains a part of focus of research, however, inequalities are on rise, which will have a direct impact on health, but this is inevitable. So we need to find out an alternative solution through research, how we see inequalities, either social determinant related inequalities or directly health related inequalities, which can impact the future of health of the people in the globe, must be taken through nursing research. Now let us understand these inequalities by few case studies. Now, healthcare disparities in rural and urban area, this is a study. There could be many more studies from India as well, but this is a urban-rural disparities of antenatal care in Southeast Asia, which is primarily done in Philippines and Indonesia, where they have found that antenatal care disparities have been found in Philippines and Indonesia. And if we look into it, then the rural Philippines have a better chances of this alcoholic by family class. So, whereas in Indonesia, the situation is reverse. So, this is how in India, if you see, the rural population is definitely a disadvantage, and urban population is an advantage of, if we talk about health disparity. Now, gender inequalities, if you see, this paper says gender inequality a case study in India, and which has found that about 63% of people give opinions that women are not treated fairly, while 71% feel discrimination between men and women in education. And 57% of these people said that parents give more importance to their sons as compared to daughters. So you can see that the gender inequality exists in this flow. Now, if we talk about the access inequality, so always the water will be drained towards the slope, and slope is attraction. The attraction is money. The attraction is better life, better quality of life, and ease of life. That is the reason, in this case study, nurses are migrating from low to higher income countries, and which is leading disparity. See, if you can access the data and understand that in spite of India and Filipinos are producing so many nurses, still India itself has a shortage of good nurses or shortage of nurses because there is a huge brain drain is happening from this country. And this paper clearly mentions that market making and production of nurses for export, and this paper talks about factors associated with nurses migration from low to middle income countries. And that gives us that, yes, there is a workforce inequality, there is gender inequality, there is a socio-economic inequalities. Now, within these inequalities, within these focus areas, now what is the future of nursing in 2030? This paper, which is published by National Academy of Medicine, and they released it in 11th May 2021, which was titled as Future of Nursing from 2030. And this clearly says that unleashing the power of nurses to achieve health inequality, which clearly mentions that countries need to understand and invest on nurses if they want that there will be somebody to care for them tomorrow. Otherwise, disaster is waiting for us. And this explores how nurses can work and reduce health disparities and promote equity into keeping costs at bay and utilizing technology and maintaining patients and family focus. Now, this also says that potential themes and areas which can focus related to research, and that is that promoting health equality and social justice, advancing nursing education, harnessing technology and innovation in care and nursing education, transforming healthcare delivery, and leadership and policy advocacy to the governments and politicians. Now, National Institute of Nursing Research is one of the 27 institutes and centers that comprise National Institute of Health. And if we look into the strategies of 2022 and 26, which talks that to lead nursing research to solve the pressing health challenges and inform practice and policy optimizing health and advancing health equity into future. And they have highlighted these areas where nursing research need to focus between 22 to 26. In India, unfortunately, we do not have such institution. We do not have any body which says that which are the target areas where the nursing research need to be focused. I'm talking about this from United States. So they say health equity, social determinants of health, population and community health, and prevention and health promotion, and systems and models of care are the 5 areas where most of the research has to be focused between 22 to 26. And yes, they are doing, and funding happens. And basic guiding principles is technology, discoveries, advanced equity, and innovations. These are the focus areas where research need to focus. So this framework was given by National Institute of Nursing Research regarding focus area of nursing research, where there's 4 rounds which has been there in center, which is health equity, social determinants of health, population and community health, system and models, and prevention and promotion of health. And this will ultimately affect policy. And this policy will finally come on ground in hospitals, communities, schools, homes, workplaces, long-term care, and clinics, and ultimately it will help in improving the health of the people, and it will meet out the solutions for health challenges which healthcare professionals and society is facing. So they have also concretely said that there are five focus areas, that is advancing nursing research, training and career development, interdisciplinary research, technology and innovation, and dissemination and translation of research findings. Collaboration and partnership is very important. They have highlighted into their document, and they said that this will bring out a diverse innovations which will ultimately help the the nursing education and patients at large. And this paper, which is on collaborative research partnership and support of nursing excellence, have proven that once we have interdisciplinary collaborative research, will definitely provide us a better evidences to advance. However, these futuristic nursing research is not without challenges, and these challenges are from where we will bring them. There could be ethical and legal considerations about advancing technology and over technology into it. Integration of technology within the health, interdisciplinary collaboration with whom we should collaborate, physicians, paramedics, or to whom. Cultural and social acceptance remains always challenging because we resist the change. Education and training should be in what way, how, and it will evolve and time will tell us. But yes, these 6 challenges remain to us. But how to overcome these challenges are, we need to search from where we can get them. We should invest on infrastructure. We should promote interdisciplinary collaboration. We should search the stakeholders and people who can partner with us. And we need to embrace technology by innovations and address ethical and regulatory considerations, build research capability among nurses, and translate research findings into practice. To conclude, by applying a futuristic nursing research approach, which I have listed through the US model of Institute of National Importance and National Institute of Nursing Research, we can provide a targeted and effective care, ultimately reducing healthcare disparities and health outcomes of the people. So we need to be prepared for future of nursing, because ultimately the future of nursing will be defined by futuristic nursing research approach, as the nursing research is a mother of nursing science. So to end with the Steve Jobs quote, that innovation is ability to see the change as an opportunity, not the threat. So we need to have we need to innovate. We need to have the high focus areas of futuristic research, and we need to work upon it so that we really can make a societal impact. Nursing research. Thank you so much. These are my references. If any questions, I'm happy to take.
Thank you, sir. Session is open for